For this particular output, we were tasked to manage clients using an electronic medical record. We will be using the OpenMRS as a simulation. So let's get started. So now maglo-log in tayo dito sa OpenMRS, then register a patient. Ayan, fill upan natin tong mga to. Name, the family name. Ang gumagawa tayo ng bagong record dito sa system. So, under birth date, pwedeng yung date or yung estimated years, estimated months. Then under contact info, yung address. Mahalagang nilalaman natin yung mga ganitong information ng patient kasi ito yung mga basic information about sa kanya. Philippines. Okay. Including the phone number. Okay. Then, relationships. Pwedeng parent, pwedeng siblings. Then, yung name. Then, next. Basta yung mga relatives na pwedeng maging contact person. Ayan. Then, double check, name, gender, birth date, address, phone number. Okay, we're good to go. So, confirm submission, confirm. Ayan. Na-generate na yung patient record. Then, we will start the visit. Confirm. Under here, nakalagay outpatient siya. So, admit to inpatient. Then, select natin to inpatient ward instead of isolation wards. Hindi naman contagious yung patient. So, capture vitals. Dito sa vitals, nandito yung height, weight, ayan, automatic yung BMI. Ito yung mga baseline data, katulad na lamang ng vital signs. Ayan. Mahalagang mag-gather tong mga ganitong info dahil baseline nga, magiging mahalaga siya sa paggawa ng mga medical decisions involving the patient. Next is yung visit note. Andito naman yung diagnosis. So, nagtatai daw siya. Ayan. So, dito naman sa visit note is yung primary diagnosis na nakalagay is a diagnosis na nababasa ng system as a medical. So, as nurses, we have our own form of making a diagnosis. Yung nursing diagnosis, ilalagay natin siya under ng clinical note. Tapos, under clinical note, andito yung mga subjective and objective na magsusupport doon sa nursing diagnosis. Abdominal pain. Ayan, ilalagay ko lang ulit yung vital signs na in-input natin kanina. Our nursing diagnosis is diarrhea related to exposure to toxins as evidenced by bowel urgency, hyperactive bowel sounds. Then, i-include na lang din natin dito sa clinical note yung plan, interventions, and yung evaluation. Yung mga nino-note natin dito is yung hindi fixed sa system. So, parang patient-specific to. mga pinaglalagay ko. Nagba-vary naman yung situations ng bawat patient. So, particular lang to and exclusive to sa patient nating si Jervin. So, ayan. Rundown tayo. Double check. Okay, save. As reported by the patient, nagkaka-diarrhea daw siya. So, andyan admission, vitals, visit note. Ito na yung mga pinaggagawa natin dito sa current visit na to. So, scroll down. Ayan, ito na yung mga information. Then, proceed tayo sa allergies. Add new allergy. Sabi ng patient, may allergic reaction daw siya sa shellfish. So, dito tayo sa food, then shellfish, and reactions. Nagba-vary yung reactions per patient, so mahalagang i-identify natin. Yan. And then, yung mahalaga ding i-input natin kung ano yung allergy, yung other medical history ng pasyente kasi mahalaga siyang considerations ito sa mga future medical management na gagawin ng ibang healthcare provider. Most especially ng mga physicians in prescribing medications. So, okay na tayo dito sa allergy. Return. Ayan. Nagawa na yung record ng patient. Scroll down. Dito na yung contact info, diagnosis, vitals, an electronic medical record holds a lot of information na mahalaga sa mga further decisions and interventions involving the patient. So, ayan, may general actions din dito sa system. Then, current visit actions din. And visit na tayo. Pero bago yan is i-double check muna natin dito sa homepage kung nahanap yung record ng patient. So, ayan. Nandyan naman. Then, pwede din tayong pindutin yung capture vitals. Para kapag clinic natin yung patient is doon agad dun sa vitals. Then, may confirmatory din, is this the right patient? I-double check natin kung right patient, then right information yung i-input. Then, end this visit? Yes. Then, ayun yung naging visit natin.
A workflow supporting the use of an electronic medical record in healthcare management begins when an appointment is requested via phone, email, or online scheduling. Here, either the patient's medical record is accessed or created in the database. Data, such as the demographics and contact information, are gathered. Upon arrival of the patient to the facility on the day of the scheduled appointment, payment procedures or verification of insurance is done before the patient is permitted to see the medical practitioner. Now, on the preliminary, this phase in the workflow consists of gathering information prior to the examination, such as getting the vitals and the medical history of the patient. Data is encoded electronically into the patient's medical record. The electronic medical record promotes organization of a complete record of patient history in one easily accessible file. A complete patient record in digital format makes it easier to access a proper documentation, which is beneficial in rendering an appropriate medical service needed by the patient. During examination, the medical practitioner assesses the patient and documents all relevant information into the system with the use of a digital device intended to access and edit the patient's medical record while doing the examination procedure. Electronic medical records are designed to quickly obtain common problems and pertinent details, limiting the amount of time spent entering this information. Also, the medical practitioner can utilize the electronic medical record to review allergies and conflicting instances so that the physician may proceed in prescribing the right medication if necessary. The system must have been built accordingly with intricate features to promote patient safety at all times. And after the examination is the last phase of this workflow, which is the checkout, wherein the medical practitioner may request that the patient comes back for a follow-up visit or refers the patient to another practice. With the use of an electronic medical record, scheduling a future appointment is not a bother. In addition, in terms of a referral visit, the electronic medical record provides access to a complete medical information about the patient, so other healthcare providers do not have to fill in partial records.